Treatment of prosthetic joint infection. Non-operative treatment. Chronic suppressive antibiotic therapy may be used in patients unfit for surgery or those who refuse it. This approach aims to manage symptoms and prevent the systemic spread of infection, although the success rate for eradication is only 10% to 25%. Operative treatment. Several surgical options exist, depending on the severity and timing of the infection. These include polyethylene exchange with component retention for acute infections, one-stage replacement arthroplasty, two-stage replacement arthroplasty, which is considered the gold standard for infections more than 4 weeks after surgery, resection arthroplasty, arthrodesis, and amputation for severe cases. Each method varies in terms of indications, techniques, outcomes, and success rates.